This is Dr. Chitra here, your mentor at Study Medic and Study MRCOG, and in this video we are going to see about ECG changes because you would get quite a few questions from this in data interpretation. Now, what is the agenda for this video? So you have to know the conduction pathway of the heart, which are the different waves that are seen in the ECG. What is the effect of electrolyte imbalance on ECG, namely potassium and calcium, and what are the changes seen in in a normal pregnancy in ECG. So I want you to pause the video here and label the various waves. So which is the P wave, which is the QRS complex, and then which is the ST segment and the T wave. Now coming to the conduction pathway of the heart, we know that it is the SA node, which is the main from where the impulse begins, and when you have the SA node as the pacemaker of the heart rate is around 60 to 80 beats per minute. In cases in which you have arrhythmias or there is some blockage in the conduction pathway, then the AV node takes over, and here the heart rate is around 40 to 60 beats per minute. In the bundle of His, it is again 40 to 60, and when you have the Purkinje fibers, it is around 20 to 40 beats per minute. Now coming to the PR interval, it is around 0.12 to 0.20. When it is more than 0.20, you call it as a prolonged PR interval. The QRS complex should be less than 0.12 seconds, and the QT interval, it should be less than half the distance between two consecutive R waves. So this is the conduction pathway of the heart. The impulse begins in the SA node. It passes to the AV nodes, from there to the bundle of His into the Purkinje fibers. Now let us see the individual waves. So in our ECG, these are the normal waves that you see. This is the P wave, which represents atrial depolarization. Then you have this QRS complex, which represents activation of the ventricles or ventricular depolarization, and followed by the T wave, which represents ventricular repolarization. So P wave, it represents atrial depolarization. Now we know depolarization is followed again by repolarization. So in this complex, where do you have atrial repolarization? So if you have a look at the picture of the heart, we realize that the atria are much smaller than the ventricles. So naturally, the repolarization wave of the atria is much smaller as that compared to the ventricles. So this repolarization wave of the atria, it gets hidden somewhere in this QRS complex. So this is again the P wave, and this is the distance between two R waves known as the RR interval, and this is your QRS complex, and this is the ST segment. Now whenever you want to know whether the ST segment is depressed or elevated, the reference point for this is the PR interval. So in reference to the PR interval, you should always talk about the ST segment, which is either elevated or it could be depressed. And then this PR segment, it is also called as the baseline level or the isoelectric level of the ECG. Let us see the effect of potassium. So potassium could either be decreased, that is hypokalemia, or it could be increased when you have hyperkalemia. Now the effect of this potassium on ECG changes, it is called as the push-pull effect. So whenever you see that there is hypokalemia, that means potassium is being pushed down, what it does, it pushes down the T wave. So you get a T wave inversion, and you get ST segment depression, and you get a prominent U wave, which is seen here. Okay, so you have this ST segment depression, there is a shallow T wave, and there is a prominent U wave. Now whenever you have hyperkalemia or potassium levels are being pulled up, so this results in pulling up of the T waves. So you get tall peaked T waves. Okay, and there is a flattening of the P wave. It results in PR elongation, and also the QRS complex is widened. Now next, coming to the effect of calcium. So if this is taken as a reference level and this is the normal ECG, in hypocalcemia you can see that the QT interval is very much prolonged, and in hypercalcemia it is the opposite, or there is a shorter QT interval. Now what happens in pregnancy? So in pregnancy we know that the baseline heart rate is increased by about 10 beats per minute. So this results in a decreased PR interval, QRS and QT intervals, but there is no change in the amplitude of the P wave, the QRS complex and the T wave. And you can get premature atrial and ventricular depolarizations, which are common in pregnancy. Sometimes you can also get a Q wave in lead 3, which is normal in pregnancy. ST segment depression is also normal in pregnancy, so you have to remember that whenever you want to diagnose AMI in pregnancy, if you have an ST segment elevation, it is something which is definitely abnormal, whereas a ST segment depression is a normal physiological finding in pregnancy. The other normal change in pregnancy is left axis deviation. So the normal axis of the heart is from -30 to 90. Whenever the axis of the heart becomes greater than -30, you will call it as left axis deviation, and this left axis deviation is seen because the gravity uterus, it pushes up the diaphragm, resulting in leftward deviation of the heart. Now in your exam you are commonly asked about which leads represent which part of the heart. So there is a mnemonic for this, and the mnemonic is I saw a lion's paw. So I stands for the inferior leads. So which are the inferior leads? They are 2, 3 AVF. SAW stands for septal leads, which are leads V1 and V2. A stands for anterior. Here the leads are V3, V4. Lions is the lateral leads, which are V5 and V6. And then you have paw or posterior, or these leads, they represent ST depression. And which are these leads? They are V1, V2, V3 and V4. So pause the video here, have a look at this ECG and try to identify the electrolyte disturbance. Okay, so the ECG, the picture that you have seen right above, this is a normal ECG, and the 3 ones below, they are definitely abnormal. So what can you see here? Now if this is the normal reference point, here you can see that the T wave is peaked. Here the PR interval is widened, also the QRS complex is widened, and there is a peaked T wave, and here there is loss of polarity of the P wave. So this represents the increasing severity of hyperkalemia. Whenever you have tall peaked T waves, remember it is always hyperkalemia. Whenever there is a widened QRS complex, it is more severe degree of hyperkalemia, and loss of the P wave or a sinusoidal P wave, there is very severe hyperkalemia. Now what are the ECG changes here? Both of these are definitely abnormal. So the image above this one, it shows that there is a lengthened ST segment and a lengthened QT interval, or a QT segment also. So this is typically seen whenever calcium levels are low or you have hypocalcemia, and in this image you can see that there is a shortened ST segment and also a shortened QT interval. So this is typically seen in hypercalcemia. So these are the common type of questions that you would expect on ECG. I hope this video was helpful to you. Thank you for watching the video and good luck for your exams.